Since we're here disturbing my breakfast, one of the things that uh, is a common question that we get is should I eat black pepper or is it going to cause stoppage of water? And the short answer is there's nothing at all that black pepper has to do with the term we call stoppage of water. Stoppage of water is urinary retention. That's something that we usually see in men, especially older men with prostate problems. Now, the prostate is a gland that sits between the bladder, the neck of the bladder, and the base of the penis. And the urethra, or the tube that carries urine from the bladder, it's as well as the tube that carries sperm, goes through the prostate on its way through the penis. The prostate itself produces some chemicals, as well as the fluid itself, some of that seminal fluid that forms the ejaculate in men. But as we grow older, the prostate tends to get enlarged. It's a condition we call BPH. And if that prostate gets enlarged in a way where it starts to compress on that urethra coming from the bladder, then you can get to a point where it can block off the flow of urine. So what you'll realize is that the urine stream gets weaker and weaker. They say instead of water in the garden, you're dripping on your shoe. That is how the stream changes when the prostate is getting enlarged. That's one of the signs you have to look out for with BPH. Less so prostate cancer, but that's a sign that you have some prostate problems. And when you have that stoppage of the water completely, your bladder can get distended because the kidneys are still producing urine. And it can get very painful. If that continues, there's back pressure on the kidneys and it can damage the kidneys as well. You get what you call hydroureteral nephrosis, which is a big name for it. It means that the back pressure causes the kidneys to start swelling as well and they shut down. So stoppage of water is actually a serious condition. If you're not passing urine as often, you notice that your belly is getting distended, you need to go to the hospital. It can also happen in other conditions like with nerve injuries, spinal cord problems. One of the other reasons you may have it is if you have actually a physical stone, like a kidney stone or a bladder stone that falls down and blocks up that opening where the urethra is leaving the bladder, and that itself can block up the entire area and end up with the stoppage of water. Now, does black pepper get through your kidneys to cause that problem? No, it doesn't. Black pepper is broken down and absorbed into the gastrointestinal tract. Nothing gets into your bloodstream from the gastrointestinal tract that is bigger than the size of molecules. It's almost like you dissolve something in water, and that is what the body absorbs. Nothing big gets dissolved. Anything that is big, it gets passed out in the feces. That's what the roughage and the fiber we talk about in our diet does. It passes out into the colon and then into the toilet. So there's nothing at all, again, in the bloodstream that is the size of black pepper grains that would go in the kidneys, because the kidneys would filter out whatever is there again. So whatever is passing through the kidneys must be liquid form, and there must be some very small molecules that can be dissolved in that liquid that will be passing out through the kidneys. So how do you form kidney stones? Well, that's another topic, but if some of those crystals, they can start to clump together once they pass through the kidneys and going into the tubes. But that's something we can talk about another time. That is how you get the stone. That would cause stoppage of water. It doesn't have anything at all to do with black pepper. So we can just put that myth to rest.